All right, guys, today I want to talk to you about an injury that we see pretty commonly, and that's a rotator cuff strain. So this typically happens. It can happen in a couple of different ways. It can happen by an overuse injury, something where you come overhead repeatedly, or can happen if you're just doing something just over time that your body's not prepared for. The other thing, it can be traumatic, like if you fall on an outstretched arm, or I've seen it happen to football players. They grab somebody and then that person runs away and it kind of jerks. Okay, that's kind of how you would get a rotator cuff injury. But let's talk about what that actually is. Okay, so the rotator cuff is actually a group of 4 little muscles in the shoulder that work together to provide stability for the shoulder. Okay, so the 4 muscles are up top here on top of the shoulder blade. That's the supraspinatus. Then you have the infraspinatus, which is right here, the teres minor. These 2 muscles run parallel on the back of the shoulder. And then the 4th one is a little muscle that comes right underneath the shoulders, kind of in the armpit area. And this is called the subscapularis. Okay, and what they do is they work together to help keep the ball of the humerus inside of the shoulder blade. Okay, so that's kind of what the rotator cuff does. So you can see how coming overhead and having that repeated movement overhead, if you do that consecutively without being trained for it, that can cause you some problems. So let's talk about signs and symptoms, or how you're going to know if you have one. Okay, so the biggest thing that you're going to have is you're going to have pain in the shoulder. And this can be in a lot of different places, but I commonly see it right through here, right kind of on the edge of the shoulder where some of these muscles attach, okay? Or I've seen it kind of in the back of the shoulder where those muscles are, or I've even had people complain of deep achiness kind of inside of the shoulder itself, okay? So that's kind of your first indication, is that your shoulder hurts. Then you're going to notice that you've got decreased range of motion. You're not able to move your arm as much as you would like to. I see this most commonly with what we call abduction, which is bringing your arm out to the side. Not only is that going to be hard to do, but it's going to be very painful. Okay, so those are the kind of things you want to look for. You want to look at, am I having pain in the shoulder? Do I have a reason for the pain? Did something happen that would cause it? And then you're going to be looking at your decreased range of motion, okay, especially, like I said, coming out into abduction. So that's kind of the signs and symptoms what you're looking for. So let's talk about treatment. There's a couple of different things that you can do for a rotator cuff strain, but the first thing that you're going to want to try is really physical therapy, okay? There are times that surgery is indicated, but we always like to start with conservative treatment as much as we can. And the way that we treat that is, number one, by trying to calm down the inflammation, calming down the pain that you're just having all the time. And we do that through general range of motion exercises. We do that through some soft tissue work. And then we kind of move on to, let's improve the range of motion. And that's where we start getting into doing a little bit more mobilization type things. Well, I would grab the shoulder and I would kind of help gradually move it into a greater range of motion. And then we do things like pulleys and things like that to help increase the range of motion. Then we need to start working on the strength. We need to restore the strength of those muscles that have been torn. And we do that gradually in a way that's not going to cause more pain, but that can help your shoulder get stronger and tolerate loading better. And then finally, we start working on getting you back to doing the things that you want to do. Once you have that baseline strength, we try to push you and challenge you a little bit more into the things you like to do, whether that's throwing, whether that's volleyball, whether that's just gardening or things like that. Whatever it is that you want to be doing, we start working into those specific activities.